are the Advocacy Fellows, heroes voicing for and empowering young adults with learning disability. We're so glad to have you with us once again. Welcome to another edition of the Advocacy Fellows Podcast. So this time we're going to talk about Oliver McGowan. After the death of Oliver McGowan, an 18-year-old autistic man with learning disability in hospital, a review found that procedures didn't work for him and his death was avoidable.
Medical notes and his family were ignored, and if staff had a better understanding of autism and learning disabilities, they could have made some simple, reasonable adjustments to his care, which could have saved his life.
He was one of the many early deaths of people with a learning disability and autistic people that happen every year. This does not include unreported deaths, near misses, or the trauma of misdiagnosis, over-medication, unnecessary restraint and exclusion, while autistic people and the people with learning disabilities face every day.
The Health and Care Act says that service providers must make sure that all health and care staff have training in learning disabilities and autism.
The Royal Cornwall National Health Service Trust has a dedicated team in place to provide support for children and adults with autism or learning disabilities. They make sure the health needs of children and adults are met within the hospital by working in partnership with all the agencies.
There are also free going to hospital books available to download from the NHS Cornwall and Isles of Scilly website.
The Advocacy Fellows wanted to take a closer look at the experience of healthcare within Cornwall and share them with you. When I had tonsillitis, I got to eat ice cream.
Ooh,
nice.
All flavours really, because it was that bad.
Well, I think it was like 2 weeks ago. I was at Weybridge Hospital, and of course it was a good. She's a good doctor. I did have a good experience in the hospital. I did.
Perfect work. I have good experience to teach people about the Oliver McGowan Mandatory Training about how they learn. So it's the way that we learn about this Oliver Mandatory McGowan Training. I'm afraid Oliver has died, so that's what I talked about in the webinar.
Oh, I've had a lot of good experiences whilst I was at the hospital.
When I heard about my nanny died in hospital.
What's sad about it?
She had something with her chest and she passed away.
Did they help you with that?
I wasn't there, but my mum and dad was. So they didn't tell me, and then they got me a stuffed sheet to remember her.
Yeah, I've had some bad experience at the hospital. Mainly the receptionist not asking who I am and actually checking me in, and then my CF team have to come down and find me.
I had my bad experience at the hospital because my granddad passed away, so that's why me and my mum had to get him to hospital in a wheelchair. It did support me on my blood test, but I didn't like it. Got to have it done.
I do have a bad experience. It was like it was the same. It was the same nurse. Like she's a nice doctor, but I told her my knees were hurting, and of course I was getting my knees and everywhere else hurt. Yeah, my knees and hips. But for some reason she just brushed it off. It's not really like that, not usually.
Any negative experiences at the moment, so hopefully it will stay like that.
Several months ago when I was at the dentist preparing to get my teeth removed, when I was at the briefing, I accidentally gave them the wrong information about what I wanted to do, so the surgery had to be postponed.
I deliver the Oliver McGowan Training to healthcare doctors and nurses to teach them how to treat people with disability.
So when I delivered Oliver McGowan to the National Health Service in Truro, I had to train the staff about what's good for visit 1 and what is bad about it. Then it's visit 2, what's good and what's bad. So I did that in Truro.
Yeah. I think what would make healthcare better is if there were more staff in to help out in the hospital, because there is way too many delays. And I think if they had more staff, it would help them out a lot more. And also, if the receptionists had a better way of talking about them, because some of them are a bit too stuck up for their own good.
I agree with Kieran on that one. If we could have had more staff in the room, then this would have helped me done my webinar a bit better.
That would be much. I would like more easy read in hospitals. I think if everyone who actually would actually understand easier speaking.
Maybe sensory toys make it better. Like if somebody is struggling or just needs something to squeeze, if they have an injection or something, or having it sat like all X-ray.
Yeah, I think one thing that will make it better is there's more medical staff, so that can prevent important appointments from being cancelled.
Shorter appointment times. Doctors and nurses to listen to the patients and the parents and read the hospital health passport, and the learning disability nurses team to actually turn up and do their job.
Our podcast shows that there has been some amazing advances in supporting people with autism and learning disabilities within the healthcare. This needs to continue to ensure that our community continues to receive the best care.
Indeed, Kieran, and a big thank you to Nick. A big thank you to you all for taking part in the Advocacy Fellows Podcast once again, who came along to this podcast today and share your experiences. This has been very interesting.
As always, a huge thank you to Nick that came out radio for recording our podcast. We are grateful for this time.
Once again, a huge thank you for listening to our podcast. Your support means we can grow our listeners and continue to be a clear voice for people with the autism and learning disability community.
Until next time, goodbye.
This video was produced by Discover Voices, part of Disability Cornwall and Isles of Scilly. To check out all of our content, simply search Discover Voices on YouTube.